the pinnacle of cardiac care is to provide pediatric cardiac surgical services. And that's an extremely complex service to provide. It's multidisciplinary, involving cardiac surgeons, anesthesiologists, perfusionists, pediatric intensivists, pediatric cardiologists, nurses, respiratory therapists. It's an incredible undertaking when one chooses to set up a pediatric cardiac surgery program.
We chose to come here to help start an open heart program here in Malago Hospital. And select children were chosen partly because of their heart defects are less complex, and we can use these as an example to teach the nurses and teach the doctors here, the surgeons, how to take care of cardiac patients and do the congenital heart defects.
I think that the doctors that are here are very good doctors, and I think that what we're doing is we're laying the foundation for them so that they can continue our efforts into the future. I think that there will need to be more trips by our team to Uganda and to this hospital, but I definitely foresee in the future a time when these surgeons will be able to do these surgeries on their own, and we just need to build on these foundations to gradually do more and more complex cases.
This trip was much more complex than that first trip. We brought 22 individuals with us from 3 medical centers, Children's National Medical Center, University of Florida, Jacksonville, and certainly our home, University of North Carolina, Chapel Hill. We together spent the last 2 years planning this trip. We're real excited to have arrived here now almost a week ago, accompanied by equipment that, again, we carried on the plane, but fortunately we had huge amounts of heavy equipment, ICU monitors, ventilators, other life support systems shipped to us thanks to the generosity and the logistic capabilities of Samaritan's Purse, a charitable organization whose home is in Boone, North Carolina.
I think something that's really important to the success of this mission and that is not often thought about is the volunteers that help out. The people from Samaritan's Purse, the Public Relations Department at UNC, and the people that work here in the Malago Hospital all have been integral to our success, and they deserve a huge thank you.
My name is Dr. Emmanuel Tala. I'm the Minister of State for Primary Health Care of the Republic of Uganda. I am here basically to thank the team from the US for the technical assistance that they are offering to our Heart Institute at Malago to get it started. We really appreciate all the contributions from the American people and the technical assistance that is being given to our staff here to enable this Heart Institute to take off. We really thank you very much, and through you convey our warmest regards to all the American people.
We all have found that coming here and taking care of these children, the children are so rewarding. They are so appreciative. They've lived with their heart defects for a long time, and they appreciate that now they're going to be able to live a normal life.
I have had an opportunity to speak with a lot of the patients and the patients' families, and I think that the overwhelming response is gratitude. I think that everybody is pleased that we're here and appreciate the effort that we're making to try to help these kids. So it's been very rewarding.
I'm Kamanyire Margaret. I'm the grandmother of Edward Kasaja, who has been all along suffering from heart. He has had a heart problem. So now the boy was operated. This was on Wednesday, and now the boy is well and doing well. So I'm really grateful to everybody who assisted us, everybody who came to rescue us, because in Africa, for us, our children have been dying because that we cannot afford to take them for abroad.
Because many people, and most people who are having these heart defects, are usually people of the low class who cannot afford surgery to go out, because it costs about $8,000 for someone to go out for surgery. And here it is really not easy for someone to raise that money, because you can find a Ugandan is living on $100 per day. So speaking about $8,000 is a dream. So someone will just give up and say, let the child die. But now doing the surgery from here was really great for them, because they didn't spend, then they sponsored them. So it really gave them a new opportunity, a future. So most of them now look forward to life in the future, because they had given up, they didn't know whether their children would grow up, but now they have another thinking that their children will grow up.
What I can say, it was a miracle. The testimony I can give, it was a miracle which actually have made Edward Kasaja to have hope. I appeal to everybody who is listening to me that let us do each and everything to assist the poor children who are dying. I feel that it could reach to every child who actually is in need, who is suffering. So, anybody, whether you have a coin, whether you have what, prayers, even, I don't know what I can say, please let us join our hands to assist these children who are suffering with heart problem. This one is when somebody gives you something, you thank. Whether how little it is, you have to be thankful. So it begins like this. Munywani wawa kuhaire utali mugaya, 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 yaba kuha kataito utali mugaya, munywani wawa kuhaire utali mugaya, kuhaire kuhaire utali mugaya, munywani wawa kuhaire utali mugaya, munywani wawa kuhaire utali Mugaya nebwa kuha katoli mugaya munywani wawa kuhaire nebwa kuha kalamu kala munywani wawa kuhaire kuhaire
operated me and I feel very good now.
Are you happy with them or not?
I'm happy with them.
Good.
There you go. You know how that works?
Yes.
Yeah, you can go from one hand.
Yes.
Yeah. Okay?
Yes.
Very good. Very
Can you
good.
try
I hope
again?
you feel better, okay?